Okay, perfect. So we are team Agent de Changement. You will have to excuse my French accent. I am not Francophone. We are really excited to talk about vaccine hesitancy in Quebec today. You will notice there's quite a bit of overlap from some of the other groups who will be going later today. So apologies for that, but the solution to our problem that we came across does unfortunately have some overlap. So we know for sure that vaccine hesitancy is a big problem across the world. And the thing is that in order for there to be a solution, it needs to be a worldwide solution because otherwise it will continue to spread. And if you solve it in Quebec, it will still be a problem somewhere else, and it can come back to Quebec if it's not solved everywhere. And one of the biggest problems that is impacting this spread is misinformation. And it's really threatening the wellness of the entire world's population. In Quebec specifically, we found that immigrants are the largest segment of people who aren't sure if they want to have vaccines. And again, here's where we start to overlap with some of the other teams. And what we found when we really dug into the data is that 26% of immigrants in Quebec are hesitant to get the vaccine. And that's not the people who are 100% sure that they're not going to get it. We don't want to go after those people. We don't think they can be reached. So we've left them to the side, and we're focusing on this middle area of people who just don't know. And with 26% of a rather large immigrant population being on the fence, that's who we chose to focus our strategy on. Quebec is a vibrant immigrant community. What we found is that 40% of people actually do come in speaking French. A lot of them come from French-speaking places like North Africa, Haiti, and France. So when you look into that vaccine misinformation, you're not always looking at a language barrier. And in fact, that's not one of the biggest challenges that we came up against. What we found is that no matter where people come from, no matter how rich they are, how poor they are, no matter how educated they are, they all have one thing in common. And that's that they have a reason to distrust the Quebecois healthcare system. And I think this is true of a lot of places across Canada and probably a lot of places in the world, but we found it was really prevalent in Quebec. A lot of cultures require some culturally sensitive care. So that could be someone who requires a same-sex doctor and may not be able to find one. That could be someone who has particular religious beliefs that they need accommodated in their healthcare, and they're unwilling to find a doctor who will meet them on that. It's not designed to accommodate culturally sensitive care, and that's really a problem for a lot of people and is a barrier to access. We found that racialized people are more likely to be misdiagnosed. So of course, sometimes this will be a language barrier, but as we said, 40% of immigrants coming to Quebec do come from French-speaking places. So it's not primarily a language barrier. It's often due to things like conscious or unconscious biases of healthcare practitioners. There's also a huge amount of systemic barriers that come forward, and they really prevent people of color from getting the same access to healthcare that white people have. And in fact, there are poor health outcomes for non-white people. Infant mortality, for example, is a lot higher in people of color than it is on white people. There's also some challenges with prescribing medication. People of color find that doctors are less likely to prescribe them life-saving medication, and pain medication in particular is a big problem, where white people are more likely to have access to pain medication than people who aren't white. And last, we did find that language barriers are sometimes an issue, particularly when it comes to understanding Premier Francois Legault's news announcements. So when he's talking about the importance of vaccines and why it's so important for everyone to come together to build this herd immunity, if the French language skills aren't there, these news releases aren't often released in another language that they may be able to understand. We saw over the past year 2 major tragedies that shone a light on systemic racism. They're not both immigrants, and in fact, one is Indigenous, so definitely not an immigrant at all. But what we did find is that there is quite a lot of systemic racism in the system. So we saw Joyce Ikakwen. She recorded a video on her own deathbed being mocked by the staff of a hospital who was there to help her. And she ended up having to release this video to expose the horrible conditions that she was subjected to. And then we also had Mirai Najumo. This just happened last week. She recorded her own desperate plea for help. And she actually said on the call, "They're killing me," claiming that they'd given her penicillin even though she was allergic to it. They didn't listen to her. And these are not uncommon things in the Quebecois healthcare system. We just don't always have access to it, and we don't always see because people aren't always recording these things as they're being put through these paces. So people, back to vaccines, people aren't necessarily undecided because they're skeptics. It's not always that they've latched onto misinformation, that they have these real concerns. They're fearful. They don't trust the medical system, and as a result, they don't trust the information that they're getting from them. So we turn to a quote by Erica Cadigan, who is the executive director of a Montreal organization called the Genesis Community Foundation. And what we found is that people don't know that they're hesitant. They're afraid. And they're calling people like her and her organization when they're unsure because they know her. They trust her, they believe in her, and they are more likely to put weight on her words versus a healthcare system that has time and time again let them down. So all the information people need to be convinced is out there. There's no lack of information. There's no barrier to access. The problem is people are actively avoiding the information that's out there. So because they distrust the medical system, they're looking for opinions from other news sources. They're turning to places like social media to get advice. And as I'm sure we've all seen, there is so much fake news on social media, but a lot of it appears to be real. You see a lot of studies and you see a lot of doctors and nurses speaking out against the vaccines. And they look legitimate because they're written by a doctor, they're written by a nurse. People take quotes from vaccine inserts, or they'll quote from a study that's out of context. There is so much fake news out there that is so easy to believe if you're getting it from a source that you believe more than the healthcare system. We also found that people who are absolutely not going to get vaccines are very vocal on social media, but people who are on the fence don't tend to go out there and post about it because they know they're going to get a lot of backlash from actually both sides, from people who are pro-vaccine and people who are anti-vaccine. So what they do is they find these small closed community groups, and that's where they have their discussion. But unfortunately, once fake news gets into these groups and these legitimate sounding articles are going around, people get more concerned about side effects. They get more concerned about the lack of long-term data. They worry about wrongful interpretations of how the vaccines work. So the concerns about RNA actually permanently changing your DNA. We know that can't happen, but there are so many doctors out there who should probably lose their license, who are saying that it can change it, that it can really lead to quite a lot of vaccine fear. And the more people learn from these news stories, the more they seek them out. And we end up with a bit of a confirmation bias going on, that people start looking for the information that they expect to get back, and they start discounting things that don't fit that narrative. So we can't put the blame on immigrants alone. That's not fair, that's not accurate. Really, the blame is on us, is on the healthcare system for letting them down so often. And that's why they're turning away from the more credible news sources. And we still have a problem. The discrimination continues. It's still happening all the time. There are news stories constantly coming out about the challenges that they're facing in the healthcare system. We're also finding that the current vaccine rollout plan is alienating immigrants and newcomers. They're less likely to have access to technology. They're less confident navigating technology. And honestly, they don't always have the time to get to a vaccine center. So we're really dropping the ball in quite a lot of places. And we need to pick up that ball and run with it. So there's no lack of facts. What we're really dealing with here is a lack of trust. It's not a knowledge problem, it's a trust problem. We've got this dangerous cycle going on. People distrust the medical system, so they start looking up that alternate information. They find these niche social media communities, they get that confirmation bias, and it reinforces their distrust in the medical system. So what we really need to do to make impact with this group of people is to break this cycle. So the facts are there, the trust is to believe in those facts is not. So what we decided we need to do is we need to find people who are trusted, people who are deeply embedded in these immigrant communities. And that's not one community, it's many communities for the different places people come from, different religions people follow, different community groups, different friend groups. There's a lot of different communities. And we need to find people within these communities who we can enable to become agents of change, to advocate for vaccines with the people who know and trust them. So our strategy, where we landed, is on activating these agents of change, these agents de changement. So this is how it works. So we reach out to these community leaders, these people who are deeply respected within these various immigrant populations, and we give them the facts and the information. We give them the tools that they need to drive change. We reach out to church leaders and we give them all the facts and all the information in an easily digestible way that then they can go and pass it on to people. And so now it's not coming from the anonymous healthcare system that's let you down time and time again. It's coming from someone you really believe in. So who will we reach out to? So religious and spiritual leaders came to the top of our list. So Mahdi Tirkawi is an imam. He's well respected in his community. He has spoken out about interfaith, but he's also very pro-science. Mayor Feig is an Orthodox Jewish, Hasidic Jewish man, a rabbi who has spoken out for pro-vaccine time and time again. So he's reaching out to the Hasidic community already, but we can certainly empower him with more information to push that even further. We'll look at elected representatives, so people who are representative of the immigrant communities that they're serving. So Yuna Bakala, Ruba Ghazal, both MPs that are trusted within their communities because they're representative of the people that they're serving. We'll reach out to campus ambassadors. There's quite a lot of young immigrants in the system, and they also have the power to influence their parents and grandparents. So people who act as peer mentors, people who champion the immigrant community within the education system. So people like Tanisha Gittins or Balarama Holness, people who really have impact at their schools and are well known for being activists and highly respected. We'll look at diversity, equity, and inclusion leaders. So people who are outspoken in that space, people like Moser Deride and Erica Cadigan, who we talked about earlier. We'll look at public figures, well-known people who came to Quebec themselves, people who are part of a community like Bruni Surin. And lastly, Quebec has a really interesting thing in their healthcare system called patient partners. It's primarily used for people with cancer. So someone who is going through a treatment, particularly a new or experimental treatment, but really any treatment, are paired with someone who's already been through it. And that way they have a support system. They have someone to ask all their questions to, who have a little bit more time than doctors, who have the personal experience so they can speak to the things they really felt, both physically and emotionally, as they were going through this experience. So we thought that was something we could replicate as well, and perhaps partner someone who's hesitant about getting a vaccine with someone who's already had one, who can speak to any side effects that they may have mentioned, the emotional feeling, that excitement of getting the vaccine and what it really means to them, and use them to kind of drive this change and help people get more excited about getting vaccinated. So for key messaging, from an awareness perspective, we want to position ourselves to empower people to become the change. And what we want to tell people is to find out how and why your community is making change happen. So again, really empowering these communities to work within their own networks, work within their own system to drive forward this change. From a reach perspective, we're looking to reframe the benefits of getting vaccinated. So by getting vaccinated, you're one step closer to bringing us together. So again, that pro-community feel, because everyone wants to get back together with their churches. Everyone wants to get back together to play basketball with your community. And the vaccine is just that one step closer to that normal. And lastly, from conversion, we want people asking where they can get vaccinated. So we want to encourage them to join the change today and get vaccinated at this location. I am not going to try and read the French, but we did have it there because in Quebec, all ads that go out do have to be in French. So why do we believe in this? So we think it really opens that conversation in a way that the doors are currently closed. So because people don't trust the healthcare system, they're less likely to go to their doctor and ask their questions. But in this case, it's someone that they trust has their best interests at heart. So they're trusting them to tell them the facts. They're not being afraid to ask them to address their concerns. They're not afraid to go forward with those questions. They're not embarrassed. They're not hesitant. And they know that they'll get respect back from the person that they're talking to. We think it gives them a highly motivating reason to vaccinate. So now we're saying it's not just about you, it's about your whole community. And we want you to do right by all of us. We want to encourage all of you to have this wonderful experience where you're all driving forward change and you're working as a community to do something that's really going to benefit all of you. It helps streamline that information, and it stops in its tracks the cycle of misinformation and fake news. So because you've got that one trusted source for information on the vaccines, it's limiting that personal research that we're finding people are being driven to. And that's where they're getting the misinformation and landing in that confirmation bias. And lastly, there is an aspect of healing between immigrants and the Quebec healthcare system, because now you've got someone you trust saying the same thing as the healthcare system that you don't. And it's bringing them together. And you're saying, well, if they're saying it too, maybe there is something to this. Maybe there's something I should pay attention to. Maybe it's not all bad all the time. There's a long way to go in really rebuilding that relationship, but it's just one small step to repairing everything that's so broken. A couple of guardrails to consider. So we have to make sure that it really is community focused. We don't want it to feel exploitative and self-serving. So we don't want it to feel like a campaign that's just driven herd immunity. We've said it, everyone needs it. That's all we're after. We don't really care about this community so much as getting them on board with this thing that everyone's doing. So it really has to feel that we care about you, your community, where you're coming from, and we're trying to help you. We have to make sure we find the right interested community leaders. So we had some examples earlier, but obviously anyone carrying this forward would have to do a lot more research until nailing those exact right people to reach out to. And then you have to have those conversations to make sure that they are genuinely invested in the cause, that they're willing to put in the time to learn those facts inside and out so that they're able to answer all those uncomfortable questions. And lastly is we have to make sure we don't overpromise a return to normalcy, but that we're really focusing on that message of one step closer. So we have to be really cautious how we frame that benefit and make sure that we are really addressing something that's realistic for where we are right now. So what could this look like? We thought we could mock up some transit shelters in these communities. So in areas where a specific immigrant group is likely to be found, we would have people who look like them on these bus shelters, encouraging them to become an agent de changement. And then we would, of course, drive further information from there, encourage people to learn more, reach out to their community leaders, and ultimately put them in touch with people that they can trust. We would also have these kits that we would directly reach out to community leaders in. So a box with all the information that they need to really answer those questions. This one is in French because, again, things need to come out in French in Quebec, but we could also potentially look into translating them into different languages for each group so that they have the language in their own language to be able to answer those questions. Because even if French is your first language, people in your community may speak something different. So it's just as important to be as accessible to the people as you possibly can. And that brings us to the end of our presentation for today. So thank you.